Welcome to this short video on preparing IV antibiotics for OSCEs. The objectives of this are to know how to check the drugs, to be able to mix the drugs, to be able to administer the drugs, and to understand why people fail this station. The first thing to say is that it's difficult to predict what would come up at this station, what type of antibiotics, so this video is just giving you an overview. There are a couple of different ways to administer an antibiotic. One is via an IV push. That's giving the antibiotic by an injection over approximately 5 minutes. The other is by an IV infusion. That's using a drip to give it over approximately 1 hour. Students would fail this station because they fail to follow ANTT guidelines, because they don't wear gloves during the station, because they're unfamiliar with the equipment or the procedure, because they fail to make the required safety checks when giving IV medication. Begin by introducing yourself with your full name and title and confirm you've got the correct patient by checking their name and date of birth. Explain the procedure to the patient and gain their consent. Check the patient prescription details against the patient's name band and check that they have a cannula in and this is less than 3 days old. The equipment you require: antibiotic in a vial, probably a dilution solution depending on the type of antibiotic, a syringe and needles, an ANTT tray, chlorhexidine based wipes, non-sterile gloves and a sharps bin. If you're giving it as an IV push, you'll probably need an IV flush, which will require you to have a 10ml syringe, 10 ml of saline and a couple of needles. If you're giving it as an IV fluids, you'll need a bag of saline, usually 100 ml, an IV giving set and a drug label. Check the IV antibiotic, the name and the dose, against the prescription. Check the prescription against the patient's name band. Check the expiry date on the antibiotic. Check the dilution solution for its expiry date, and it may be worth checking all this with the examiner as well. So begin. Put on an apron, wash your hands and clean the ANTT tray, and then wash your hands again. Get out your equipment. So there's the antibiotic, there's the diluent for the antibiotic and a flush. Take the syringe and attach it to the needle. And that protects your key part so it can go in the ANTT tray. And then repeat with another one. The first one's for drawing out the flush, the second one is for drawing up your antibiotic. If you're going to give your antibiotic via an IV infusion rather than an IV injection, then at this point open up your bag of saline into your ANTT tray and do the same with the IV infusion set. Once you've done that, wash your hands. Take the top off the antibiotic and give it a clean with one of the ChloroPrep wipes. Take your syringe and begin by drawing up your flush. Invert the vial and aspirate back 10 ml. Once you've done that, to ensure that you don't resheath your needle, remove the used needle off the end and put it in the sharps bin and then replace it with a clean needle on the end. Then repeat the process with the diluent this time. Once you've drawn up your dilutant, inject about 5 ml into the vial and then release the plunger and allow the air to come out of it. Holding the syringe firmly, give the vial a good shake or agitate it to mix the antibiotic. When that's done, invert the vial, inject the air back into the antibiotic to create a positive pressure in there, and then allow the antibiotic to drain back into the syringe, pulling back on the plunger a little bit to help it. Once you've done that, get rid of the used needle and replace it with a clean one. To avoid confusion, attach a drug label to your syringe with your antibiotic in to let you know which is the antibiotic as opposed to the flush. However, if you're going to give the antibiotic by IV infusion, inject the antibiotic into the bag through the injection port and then run the bag through as described in setting up an IV infusion. Now remove your gloves, wash your hands and put on a clean pair of gloves. Take one of your wipes and thoroughly clean the injection port on the cannula. This one's got a one-way valve on it. Remember, that's your key part, so keep it clean. Remove the needle off the end of your flush and flush the cannula with a couple of mils of saline. Once you've done that, replace the needle. Take your antibiotic and get rid of that needle. Connect it up to the injection port and over approximately 5 minutes deliver your antibiotic. If you're going to give your antibiotic via an IV infusion, then once you've flushed it for the first time, connect up your IV giving set and then set the drip rate on it. Finally, once your antibiotic is delivered, then take your flush and finish flushing your cannula through. When you're done, thank the patient and tell them it's over, remove your gloves and wash your hands, sign the prescription form, be aware of the risk of antibiotic reaction, document what you've done and tell the examiner that you've done and thank them. If there's time at the station, clean up any mess. So to summarise, introduce yourself and explain what you're going to do, check the prescription against both the patient and the drug you're going to deliver, and then use an ANTT process to draw up the drug with your gloves on, change the gloves, and flush, administer the drug, and flush again.